Okay, we're going to take a look at our last presentation here, and that's going to deal with slides on professional ethics and models of nursing. So we're moving into applied ethics now. The section on the four ethical theories dealt with meta-ethics and general approaches to how we determine something as ethically favorable or not. In applied ethics, we're going to be moving more into specific questions of practice. Um, and here, we're obviously looking at the purpose and practice of medicine. So we can see professional ethics or applied ethics in business law, in the criminal justice system, and lots of other areas. But I just want to highlight three particular areas as we turn to the healthcare system. One is to look at their discussion of what is the purpose of medicine and really seeing that there might be multiple understandings of the goal or telos of healthcare. Second is trying to define a definition of medical practice and really seeing who are the stakeholders in defining professional ethics in the healthcare system. And then lastly, to kind of highlight those three models of nursing, given that we're going to be looking at ethical codes in nursing and professional ethics in nursing, I just want to take a look at some of those models. So one of the things your author notes is that there may be different purposes to medicine depending on the context and needs of a situation. So they suggest if the purpose of medicine is the prevention of death, certainly in some cases that makes a lot of sense, but for a terminal illness and one that is in the final stages, if the goal is simply the prevention of death, this could lead to really what they call heroic measures, which can involve procedures that are both costly and cruel to the patient. Next, we might say, well, maybe the purpose of medicine is really the pursuit of health and happiness. And certainly that can make a lot of sense as well. But this might also put the healthcare provider into areas of the health within the community, larger questions about disease control. Happiness might lead us down towards the road of psychology. Does that create too wide of a goal for the purposes of a healthcare provider? And lastly, suggesting that the goal is to alleviate suffering and advocate for the patient. We're certainly going to see more of that in our next unit on informed consent. But how can this role of individual support be balanced with issues of distribution, oftentimes with scarce resources within our healthcare system? So we need not come up with an agreed upon purpose of medicine to recognize that there are ways in which we can sort of define medical practice and develop professional ethics around it. So the two basic steps or things that are needed in defining a medical practice are an accurate picture of the patient's problems. We can call this the work around a proper diagnosis, and then an end or goal that the patient and physician have determined that they want. This is sort of the prescription, right, or the treatment that is agreed upon given that condition. As we think about how we can do that in an ethically informed way, there's really two perspectives that need to be defined or at least included in the conversation. Certainly members of the profession. Here we have the American Medical Association. There's other professional organizations as well who have been through the field and can give us some understandings of best practices. But also the society, the clients can help determine and define expected roles. So it's really this mutual conversation about guidelines and practice that can help define a professional ethic. I wanted to look at those three models of nursing. They're mentioned briefly in the chapter, but I thought they were important in thinking about some of the stakeholders and some of the lines of communication and interested parties as we think about ethics. The first was the bureaucratic model, and it still suggests that this is a model that is sometimes seen in hospitals. Here, the nurse has the primary virtue of loyalty, making sure that there's a rapport upon the healthcare team, and working out the details of institutional coordination. Certainly, this is not the ideal, and as I think the image and just our general ideas of bureaucracy entail, this can often be seen as kind of confining and not leading towards lots of critical analysis. The second is the physician advocate, which again, your text makes clear is not a viable model. Here, the nurse is simply seen as an extension of the physician's hand. Loyalty as a virtue is promulgated, and in early as 1973, the International Council of Nurses explicitly rejected this role. And yet, I would say that sometimes this is still a common image of the nurse, whether in television or in other areas. The nurse kind of seen as the handmaiden of the physician is something that maybe even some physicians carry forward. The most ideal, certainly in terms of the reading, and I think it makes sense given how we're defining ethics, is to see the nurse as the patient advocate. Here, the nurse is an independent, although interdependent professional whose ethics cannot be dictated by others. The primary obligation is care for the patient, and it does make sense that all should be clear about these roles, not only the nurse but all the healthcare providers as we do ethical analysis. So as we move forward, we're certainly going to be looking at these bioethical principles and certainly the nurse's code of ethics. But we want to note that healthcare has changed as our society changed. There's a growing need for more healthcare agents. Your text notes that people are both living longer and physicians are choosing different roles and looking to do less solo practice. I think this is one of the things that medical ethics has seen with a decrease in family care or primary physicians. And it makes sense given that a lot of times folks are leaving training with a lot of debt. So decisions have to be made about finances and time. We can also see emerging models and roles such as concierge medicine. Here, doctors or nurses are not so much working with the common good, but finding ways in which a consistent client base can be found and paid for. And also just seeing ethical diversity, both in terms of culture and religious diversity among patients and among healthcare providers. How do these different understandings of health, of community, of identity get played out as we make decisions about healthcare? So that's going to conclude our unit on Introduction to Ethics, and we look forward to talking a little bit more about informed consent in our next unit. Good luck.